Hi, this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here helping companies, along with Nick and others, reopen and operate, and also helping them with their overall employee health improvement programs. So I know this week, Nick, there's been a lot of comparisons going on between the United States and countries around the world, and you've got some specific examples that would probably be helpful to all of us.
Yeah, so we always have a tendency to hold up the US and US healthcare as doing well. I think uh, I, I, I hope most people can agree we're not doing a good job in this country. We've failed on a number of efforts, and you know the question is why and what can we learn from other countries. And I sort of picked out a couple that I thought were really interesting because I hear repeatedly, pushback. You can't compare; they're different. They're this. But Vietnam has had less than 1,500 cases for the entire duration of this pandemic. And, they're not as large as us, but they're not a small country and they're not, an island or anything. And then Rwanda, which has 1% of the GDP that the US has had less than 8,500, so 8,500 cases with fewer than 75 deaths. So think about that, 75 total in the duration, fractional. And what is it that they did different? Well, first of all, I think in both those instances, and pretty much most of the countries that we look at, anytime this comes up, they absolutely jump on it like a rooster on a June bug and focus all their attention on dealing with this outbreak. Why is that? Well, they've had experience with other outbreaks. In the case of Africa, obviously Ebola has been one of the prevalent ones. And SARS, MERS, and so forth has sort of sensitized people to, you can't discount this. You have to focus all the attention. And the other thing specifically in the Rwanda health system that I think is really important, and one that we have to sort of pivot our health system to, is it's designed to prevent sickness in the community. So this is not about the US healthcare system, which is essentially designed to treat sick people in the hospital, which is what we do, and we do it very well. But that's not helping us.
Yeah, it's fascinating. You pointed out, and it's kind of an interesting thing to say. We're going to focus up front. And we've talked about that from an employer perspective for years. And it should also be pointed out that both of those countries, are obviously nowhere near the United States in terms of technological capabilities, dollars spent, et cetera. And we've seen some other success stories in terms of things like Israel, where they've been ramping it up. And people then say, oh, yes, but they are a small country too. But you've just disproven that point by looking at those two countries. And we've also seen it with Japan.
Right.
They are taking it, as you said, they just jump on it. I can't remember the exact reference to the
A
rooster and the
rooster on a June bug. And I know I picked
yes,
that up from an American, and I have no idea what a June bug is and how a rooster's involved, but
and
it sounded good.
it's absolutely perfect. And Japan's done the same thing. They suddenly see a quick outbreak in Tokyo and they just shut it down. And so what's happened is, which just blows my mind, is they say to themselves, and I believe they've had somewhere north of 3,500 total deaths in Japan, and you talk about 75 in Rwanda. We have that number on a daily
Right.
basis in the United States. And probably for maybe a couple more weeks. I don't know which way this is going, but it's been pretty steady, holding up at that near 4,000 level or close. So obviously, you can see countries on both sides of that spectrum, from very well off, technologically advanced, to countries that do not have the resources that we have in the United States. And that really leads to, again, this whole concept. We have got to ourselves take it upon ourselves to help solve this problem and prevent the infections from happening. So, are you seeing any of that coming up? Go ahead.
Yeah, no. So what I was going to say is, when we think about it locally and individually, as an individual, it's very hard to sort of think about, a country type response and, those focuses. When it gets to the businesses and, what's the message for, our clients, our customers? Well, I think the primary message is take everything seriously. There is no sort of, oh, well, we don't need to worry about that. Focus all the attention, and not to be over dramatic or to sort of imply that things are worse than they are. Focus on the data and attention, But then the other thing that I think we've seen personally and sort of locally is these small gatherings. So we talk about super spreader events, but spreader events can be in small instances, and they tend to be in close quarters.
Yeah, it's been interesting to watch. This gets to that communication thing. It's hard for us to constantly keep ourselves aware and say, I'm going to think about COVID, I'm going to think about my mask, I'm going to think about social distancing. And so more recently, we've seen this shift, and we've heard it from some of our friends and neighbors and others who have suddenly been in a small group gathering, whether for the holidays or New Year's Eve or Christmas, and then bam, somebody came into that, and 4 to 6 people are infected. And so, again, we can't lower our diligence levels, and particularly as we're seeing more infectious variants come out, we need to increase those levels and really try to focus on reducing our indoor exposure, wearing a mask, washing our hands. It's not over yet, and I believe we'll be doing that, as you probably point out a number of times, Nick, as the physician. Even with the vaccine, there's still going to be a need for us to maintain many of these behaviors.
Yeah, we're not going to stop any of this anytime in the near future. At some point, it's going to change. We'll have a better understanding of transmission and so forth. If I had an overriding piece of advice, it's treat everybody as if they're a potential infector of you and that you are potentially infected. And I know that's a horrible thought, but it doesn't have to translate into the way that we treat people, but it translates into our behaviors. And that's the way that I think about everywhere that I walk into. What is my risk based on what I'm seeing? I know you do that all the time locally, right?
Yeah, we've really been trying to do it, and upping my game myself and the family, et cetera, to really begin thinking about this, and we all can play a role in it. And if you'd like more information about the company and the work we do and some of our clients, you can go to the website we've got listed below and check it out. Give us a call and go ahead, and we'll be happy to talk to you or help you out as you're looking at this issue and others around your employees and their overall health and prevention. So with that, this is Fred Goldstein with Accountable Health. Thanks again so much this week, Nick. It's been an enjoyable one, and looking forward to next week's as well.
And this is Dr. Nick. I'm the incrementalist here with incremental insights for a better business, better health.